Intrauterine infection in newborns, HIV, AIDS in infants. Perinatal and neonatal infections. The newborn's increased susceptibility to infection and decreased ability to respond to it make risk assessment and early intervention vital to reducing morbidity and mortality. Assessment of risks begins with a review of the maternal history and intrapartum record for evidence of maternal infection. Predisposing risk factors for newborn infection: maternal factor, malnutrition, lack of prenatal care, substance abuse, torch infection, prepartum maternal fever, clinical amniocentesis infection, vaginal colonization with GBS, perineal colonization with Escherichia coli, prolonged rupture of membranes, more than 24 hours, sexual transmitted infection. Predisposing risk factors for newborn infection and neonatal: premature, prenatal asphyxia, concurrent neonatal disease, galactosemia, congenital asplenia, male sex. GBS is a gram-positive anaerobic bacterium that colonizes in the vagina or rectum of 10% to 30% of pregnant women. It is the most common cause of neonatal sepsis and meningitis. Treatment is with benzopenicillin or ampicillin. Escherichia coli is a gram-negative root that makes up most typical human fecal flora. It is the second most common cause of neonatal sepsis and meningitis. Treatment is with aminoglycoside alone or with cefotaxime in meningitis is suspected. Tuberculosis. The incidence of tuberculosis has resurged since the late 1980s years in association with the HIV epidemic. Transmission is by inhalation or ingestion of infected droplets, ingestion of invested breast milk, or contamination of traumatized skin or mucous membranes. The Mantoux perfiled protein derived skin test usually is positive once the infant develops antibodies to the bacilli. Infants are minimal risk and require no anti-TB treatment if they are born to mothers who have completed treatment for tuberculosis and have no evidence of disease. Sexual transmitted infection. The Control Disease Center suggested gathering information from clients about sexual transmitted infections using the 5 sections: partners, prevention of pregnancy, protection from sexual transmitted infections, practices, past history, sexual transmitted infections. Congenital syphilis. Syphilis can be transmitted across the placenta and through contact with active genital lesions during the delivery. Evolution for congenital syphilis includes physical examination and serological testing. Nurses should examine cerebrospinal fluid in all infants born to mothers with syphilis during pregnancy and those with suspected or proven congenital syphilis. Treatment at any stage is with parental penicillin G or benzopenicillin. Breastfeeding is not detected for infants whose mothers have been treated. Gonorrhea. Intrapartum contamination usually occurs during contact with maternal secretions in the birth canal. It also can occur in utero after rupture of the membranes. The most common clinical manifestation in neonates is ophthalmia, neonatarum, or conjunctivitis. Correct administration of prophylaxis prevents gonococcal infection in most infants. There are no contraindications to breastfeeding with maternal gonococcal infection. Hepatitis B. Hepatitis B is a hepatitis virus most often seen in prenatal and neonatal infection. Perinatal transmission is 76% in mothers with acute hepatitis B in the 3rd trimester and 10% in the first 2 trimesters. 90% of infants born to women with hepatitis V, surface antigen and hepatitis B, envelope antigen are at risk for hepatitis B during the first year of life. Hepatitis B neonatal infection usually occurs at birth when the infant comes in direct contact with contaminated maternal blood and vaginal fluid. Our virological pediatrics doctors recommended infants born with hepatitis B and women need use dose hepatitis B immunoglobulin vaccine at birth. HIV is transmitted to the fetus in utero transplantal intraparentally through contact with maternal blood and breast milk. Infants usually develop things and symptoms between 4 and 6 months of age with an incubation period of 6 weeks to 10 years. HIV with proper screening and antiretroviral prophylaxis during labor and after birth, the risk for vertical transmission rate decreases. Research into pharmacological prevention in the neonate is promising, with clinical trials examining contributions of antiretroviral agents. Chlamydia is the most widespread sexual transmission infection. Chlamydia trachomatis is a bacterial agent most common found in perinatal infection. Transmission occurs at birth when the infant comes in contact with contaminated vaginal fluids at the birth canal. Excretion occurs in approximately 15% of infants born vaginally to infected mothers and in some infants delivered by cesarean with intact membranes. Breastfeeding is permitted unless antibiotics are used to treat maternal infection or contraindicated. Herpes simplex 2 is the most common cause of disease in the newborn. Transmission usually occurs intraparentally with ascending infection after rupture of membranes or through contact with an infected birth channel during vaginal delivery. The risk of contracting the disease is 30% to 50% in the mother is experiencing a primary infection compared to less 5% with a recurrent outbreak. Treatment includes antiviral pharmacological intervention with acyclovir and vidarabine. Torch infection, this is abbreviatura, and this abbreviatura means T, toxoplasmosis, O, other infection, it means hepatitis, syphilis, HIV, and another infection, rubella, cytomegalovirus, and herpes.